That would help. They'll fix everything, right? You want robots to take your jobs? No? All right. So let's do what we can do to be more responsive. Okay? So we need to make sure we have a prepared healthcare workforce addressing the growing needs for this changing population. Okay? Are you all prepared to fight the robots? Good.
I'm really nice to mine for when they take over the world. I say, Alexa, remember me. I'm gonna take over the world.
All right, so aging is more than just a number. 65 is usually used as a cutoff in a lot of papers you would read, in a lot of healthcare policy. We use 65 as we call somebody old once they're 65. Who knows somebody who's 65? And okay, have you asked them if they feel old? Do they feel old? Do they call themselves old? Yes? No? Some people don't feel old at 65. A lot of people think that's the middle age. When you're expected to live 90, is 65 old? And how does that feel to be given a label of being old? And how long is that category from 65 till you die to be called old? It's a big, huge group of people that we're calling old. And so this big group would have a lot of diversity in how they age and how they experience that aging. So we need to make sure we understand what a label of being old means and where it's useful and where it's not useful. Okay? You all are called teenagers. Being a 13-year-old is very different than being an 18-year-old. Similarly, being a 65-year-old is very different than being somebody who's 90. So it's a big, diverse group. And also, chronological age, the number doesn't really match up with what is happening to your body a lot of times. A lot of people who are 80 are much healthier than people who are in their 60s. And so you have to look beyond that number and look at the individual behind that number. Okay? And so every older adult is unique and you need to approach them as an individual. Just remember that. The same as teenagers, you all want to be individuals. Older people are individuals too. So let's talk about some of the myths about aging and how that leads to a lot of ageism in our society. Our society really values being young, right? You guys must feel great, right? Being young. What do you know about ageism? Anybody?
It's discrimination towards people.
Older.
Let's say like someone wants to get a job.
Mm-hmm.
So the other person will get the job. People discriminate.
Mm-hmm. And is that right or wrong to do that? It's wrong, right? And it's a legally protected category. So you cannot discriminate, just as you cannot discriminate based on sex, gender. You cannot discriminate based on age. But because of a lot of stereotypes and myths about older people, we discriminate against them all the time, very implicitly, especially in a healthcare setting. So we need to, look at all these negative stereotypes that we hold as individuals and how that impacts our work as healthcare providers. So let's go through some of them. Where do you think most of older people live? So you think most of them live in a nursing home? Would everybody agree to that? Yep.
A house, like a rental house or somebody else.
Yeah. So actually, if you look into the statistics, only a 3.1% of older people live in nursing homes. Most of them are actually living in their own homes. They're living with their spouses and partners, or sometimes they're living alone. And so we need to make sure what our mental picture of the elderly is what it actually is and not what we have in our head. And what do you think most older people, what does their financial health look like? You're allowed to cheat. So it's mixed, right? Some of us, when we think about an older person, we think about somebody who's retired, who, you know, had a lifetime of work, was able to do, you know, have a home, have savings. But a lot of times, older people experience poverty the same way as everybody else does. And around 14.5% of people who are above 65 are under the poverty level in this country. So, and then all those discriminations that we talked about, that are disparities that exist in this country, overlap older people too. So racial disparities, economic disparities, older people are going to be experiencing the same things. I think one thing to like really keep it in mind, older males have incomes that are more than older females. And you have to keep that in mind. You also, one another, I think I didn't put in this slide, is that females tend to live longer than males. A lot of them they're more widowed females than widowed males. So a lot of times, an older woman, she would have to face all that barriers to her health and productive life more than a male when they get older. Sexuality. How many people think that older people have sex? Okay. How many teenagers have sex? Right? So, in general, not you, everybody. So that doesn't change. Why would you think older people would stop having sex? That's a normal body function. And when you actually ask, 76% of older adults say that sex is an important part of their life. And around 40% of them say that they're still sexually active. So we need to keep that in mind, because we need to provide them with the healthcare system needs to provide them with resources and treatments and care that they need for their sexual health. It used to be that we used to screen people for sexually transmitted infections up till age 65 and not after that. And a lot of these people were going untreated, but they were still having sex, and they were still having all these, they needed that care that was not being provided to them just because of these perceptions that we hold about older people. So we need to really make sure our perceptions are what the reality is. Similarly, about LGBTQ people, older people identify similarly as younger people have identified. They might have had different cultural contexts growing up, but that does not mean the healthcare system should not see them as invisible. So you need to make sure that your forms and your assessment gives an opportunity to the people to identify the way they do. So you can provide them the care that they need, and they have that relationship with you as a provider. We don't have any statistics on that because the government doesn't collect it, but there estimates that around 2.4 million older folks are identified as LGBTQ. Similarly, education and employment. A lot of these older people went through college, went through high school, have a lot of life experience. Some of them are still working, so a lot of time we have this perception that most of them are retired, whereas around 19% of them are still working after the age of 65. So we want to make sure that you don't skip these questions when you're asking an older folk about their life. What do they do? You don't just assume things. And what is important to them in their life. So we need to see aging as beyond just a number. We need to see it as a developmental stage. Is teenage considered a developmental stage, right? Why do you think that is considered a developmental stage? What is happening when you're a teenager?
Because we're going through these changes that
Yeah, you're going through a lot of changes, right? So your body is changing, how the world sees you is changing, your responsibilities are changing. Aging is also a similar process. Your body is going to be changing again. how the world perceives you is going to change. Your relationships are going to change. Where you live is going to change. All those things that are changing. And how you respond to it, you develop through that process of change. And so you need to make sure that we perceive this experience as a long developmental stage than just a number. And we take care of all these needs when people are going through this stage. Yeah. How do you feel when somebody just says that, oh, that's just you being a teenager? That feels wrong, right? When all your experience, what you're going through, is just labeled as, oh, you're just being a teenager. That's just teenage. It's similar when you're old, when somebody just says, oh, you're just getting old. So some of the physiological changes of aging. Anybody knows what physiology is? Who wants to be a doctor? You want to be a doctor? Tell me what physiology is. Study of the mind. That's psychology. Close.
The body.
Yeah. So Yeah. So physiology is the study of how a normal body functions, and so we need to look at aging as a physiological process, a normal process, than a disease process that needs to be cured. There's no cure for aging. Or is there? Maybe there is. I'll keep it a secret. So, what are some of the changes that happen when you age in your body?
Your bones start becoming more fragile.
I'm gonna start pointing now. Quick.
The first article I read.
Hmm?
You get tired.
Mm-hmm. Mm-hmm. Heart. Okay.
You're more like prone to getting sick.
Mm-hmm.
Like your immune system.
Okay. Front row. Mm-hmm. Joint they get harder. So a lot of things are going to be changing in your body. Just like during your teenage, a lot of things change in your body. Just as you age, things go to start declining. And that's a normal process. And we need to have that balance of knowing what's normal and does not need to be treated, and what's abnormal and needs to be treated in the medical field. So for that, we need to have a comprehensive assessment of an older person when they touch the medical system, all right? And a comprehensive assessment would include not just the medical assessment, but we need to know how their functional assessment, we need to know their social assessment, their psychological assessment, all those things that go into that experience of aging. And I'm just going to talk a little bit about it. If I go into too much details, just ignore it. And ask questions at any point if it's confusing. Yes?
What would be a social assessment?
We'll go through that, okay? So starting with the medical assessment, by the time people get old, they would have collected a lot of diagnoses. They might have seen a lot of doctors. And on average, they would have 4 to 6 diagnosed conditions by that time. And so when you're seeing a patient for the first time, you need to make sure you ask them about all their medical history. You review all their diagnoses, you review what surgeries they had. So that's just part, and then it might require an extra time than a younger person, because then they have this lifetime of all the things that they collected and were labeled. Sometimes they need a reassessment. Sometimes they might have been diagnosed with something that might be a misdiagnosis. So you need to make sure you know everything on their medical history. There are certain things that are more common in the older population. It's called geriatric syndromes. Geriatrics is the study of older folks. And, these include pressure ulcers, incontinence, falls, functional decline, and delirium. Don't go into those terms. You will learn them later on. But you just need to know that there are certain things that are more common. there might not be diseases themselves, but just might be a side effect, so to speak, of aging. Okay. Another thing is the visual and hearing. Older people would develop cataracts. They would have harder time seeing things. So we need to make sure you screen for that, screen for their vision, and then screen for hearing loss. Those are the two things that you would see very often in an older person. You want to make sure you go through all their medications. So ask them or their family member to bring all the medication in, review them, see what they've been taking. Make sure you ask about any over-the-counter drugs that they might be taking. And sometimes people might be from different cultures, might be also using things that are, herbal medicine. So you need to make sure you take into account everything that they might be taking. And a lot of these people would have a lot of medications prescribed to them, and that is a risk factor. So anytime people have more than 4 medications prescribed to them, you need to really look at, do they really need those medications? Sometimes we prescribe one medication, then we prescribe another medication because the first one had a side effect, and we had a medication for the side effect, and it just goes down the lane, right? So you need to really make sure what do they actually need, and some of these things might be changing, right? Their kidneys have a different function now, so they might not need a medication or higher dose because their kidneys is not able to excrete that drug from their body. So that needs to reassessment as you age. Another thing is nutritional evaluation. You need to make sure that older people are eating enough. Person who's yawning, do you think older people eat enough? No? Why do you think that is?
Because I think that it's just
Pain and struggle? Why is it a pain and struggle?
Because sometimes, like, with their, like, jaw functions, it's harder for them to, like, chew, like, meats and stuff. So
Mm-hmm.
it's harder to, like, take in, like, all the food.
Good. How many older people have teeth? Yes.
I was gonna say, like, it might be a struggle too because, like, when you're old, some, like, your organs, like, aren't, like, doing that good, and when you eat, like, it hurts to, like, have your, like, stomach full because,
Okay. So we need to it's a hard thing. You need to recognize what might be a disease process that he might be saying, like, oh, something might be hurting, and that needs to be explored. But sometimes there are really normal things about aging that you need to respond to. Some people just don't have teeth. So you make sure you get them a dentist appointment so they can get a denture so they're able to eat. Another thing is that when you get older, your receptors in your tongue get less sensitive. So you might not experience the taste the same way. You might have seen older people use a lot of salt sometimes when they eat. So you want to make sure that you respond to that. In the healthcare setting, we always a lot of times restrict patients on their diets when they get older. Or you need to have a heart healthy diet or something because of your kidneys. And a lot of times you might restrict them, and as a healthcare system, we usually tell patients what they cannot eat. We don't tell them what they can eat, and so they might not be eating anything. Okay, so you need to make sure you screen for that. There's some standardized questionnaires that you can go through with patients to kind of assess how they're eating. A lot of times it might just be that they don't have access to food. Remember we talked about poverty? And a lot of times it might just be that they're not able to prepare their meals anymore because of their functional status. So any weight loss more than 5% in the past month, that is a warning sign, and that needs to be explored more in an older person. So beyond medical assessment, we need to do a functional assessment. What does functional assessment mean? What do you think it might mean? It's right there. Mm-hmm.
how their systems are functioning.
Yeah. What does normal functioning mean for us in our daily life? Gentlemen,
What's the question again?
what does normal functioning mean for you?
Like, have like a normal beats per minute, something like that.
Okay, your heart is beating. That's important. But beyond that, there's just some basic functions that you want to make sure that the person is able to do. Are they able to eat? Are they able to dress themselves? Are they able to go to the bathroom by themselves? Then there's certain things that are above those basic needs that are called instrumental activities of daily life. These are things that allow you to function normally in society. So you want to make sure, are you able to still go for shopping? Are you still able to manage your money? Are you able to write a check? So all these things you need to assess the assess for the patient. You need to ask these questions. A lot of times, older people would, that you would see two different kind of people. Some might be really resistant to agree that they're aging, and they would not tell you that. So you need to ask them. You'll also see patients that would tell you a lot, that would say that would kind of put everything on their aging and then prematurely restrict their activities because they think that they're aging. And that might also not be healthy, because then that is not a healthy way to live. If you're able to function and you're still kind of restricting yourself, you want to make sure you encourage them to have the normal activities. And for those that have a hard time, kind of agreeing and coming to terms with their age and their functional status, they might not be asking for help that they might need. A lot of times you need to go to the doctor to get the benefits that, for example, that you might need. So a lot of people rely on, for example, Social Security or disability benefits. You cannot get them before you see a doctor, so you want to make sure you encourage people to be open about what they can do and what they cannot do, and to make them feel not weak because of that, but just, kind of come at terms with that as part of normal process of aging. Another thing is making sure you ask about falls. A lot of older people fall. When you talk to the older people, has anybody asked about the fall?
I interviewed my grandma, and she had just recently broke her tibia, and she just tripped over a shoe at night. So it just goes to how fragile they can actually be.
Yeah. And the thing is that falling in old age is not just, you're older, you're weaker, so you're going to fall. Every fall in old age needs to be explored, because there might be it's an abnormal event. And at an old age, a fall might kill you more often than a heart attack. So you want to make sure you ask about it. Some people, again, people who don't want to be perceived as being weak or not being independent might be falling all the time, living by themselves, and they would not tell you unless you ask them. So you need to make sure you ask, have you ever had a fall in the past, this many months? So psychological assessment. What's a common misconception about older people, about their memory or their mental ability?
They forget things faster.
But do they? My grandma holds a grudge. But have you guys interviewed older people, right? Were they able to, talk about their memories, right? Extensively sometimes. So that is a common misconception that we have about older people, that their memory gets impaired. Every time there's a decline in mental ability, that's abnormal. That's not part of aging. So we need to know that. Alzheimer's is not something that everybody develops. Dementia is not something that everybody develops. You need to make sure you ask and don't kind of just say, you're just getting old. You need to make sure they go to a doctor to get an assessment, okay? Another thing is about depression. A lot of older people still experience depression. 1/3 of them experience depression, but a lot of times it goes undiagnosed. A lot of times our perception of depression changes. When a teenager becomes isolated and quiet, we get worried. When an older person gets quiet and reserved, we just think they're getting old, which is not true. A lot of these times you need to make sure, there are a lot of, again, we talked about changes in life that are happening. A lot of them might be losing their partners at that time. Some of their children might be moving away. They might need to move to a new house, a new community. So all these things are, big changes in their lives, and are they able to adapt? If not, then how then the healthcare system help them adapt? What are the resources in the community? So you need to make sure you ask and screen for that. And there's some standard questionnaires that you can go through with a patient that would help you identify these things earlier. Social assessment. Did we ask about social assessment? Right? Okay. So the social assessment, again, it's the time of transitions. These people have, some of them might be retiring, some of them might be more socially isolated. death is an important part of aging. A lot of people are dying. There's a universal experience of aging. If not your partner or loved one, your friends might be dying. So you need to make sure you assess what their social structure looks like. What are the strengths for them? Are they still? Yes.
Oh, I'm just.
Okay. And you want to make sure that you're able to connect them with the resources that might be helpful during these transitions. There are programs in the community. They can go to a community center. Some people like to go to church. So you want to make sure that they're able to be involved actively in their lives with other people. Sometimes it might just be that they're not able to, drive now because they don't have their driver's license. So make sure you connect them to services that provide transportation to older people. A big part of the social assessment, especially in the healthcare setting, is assessing for their power of attorney. So, because you're declining, the endpoint of aging, endpoint of life, endpoint of everything is death, right? So you need to make sure you have that conversation with them. What are their wishes when they get to that? Because as medical providers, we can do a lot that we should not be doing. That might not be the best for the patient, might not be their wishes, right? We can extend life for a patient, but life is more than just being alive, right? So are they still able to actively participate in that life, or are they just somebody who's just have tubes in them, and we're just kind of keeping them alive in the hospital? So that's not something that needs to be explored, especially with patients that might have a lot of medical conditions. And how do you have that conversation? How do you have that conversation with the patient, and how you have that with the caregivers? That's a really hard conversation, and you cannot have that unless you develop a relationship with the patient. And developing a relationship with that patient, you need to know all of this that goes into that we talked about. Being able to empathize with what they're going through. Okay? So, summary, aging is both a physical process, it's also a psychosocial process. So, and what is happening is that your body is declining, your world is changing, how the world sees you is changing, and all that can make you more vulnerable to diseases. Aging itself is not a disease, but it makes you vulnerable to a lot of other things. And it's a hard line that the medical community needs to recognize. We also need to recognize the role of ageism and how it comes into play in the healthcare setting, okay? And in all this assessment, make sure you're not just asking the older person what problems that they might be experiencing. Ask them about their strengths, ask them about their lived experience, because that is what is going to help you when you're treating them. That is going to help you build that trust to provide that treatment, okay? Questions?
During medical school, what made you what triggered you wanting to go into your line of work?
Specifically to aging?
Yeah.
So I'm a family physician. My approach to healthcare, just medicine, was that I want to work with everybody, and I also don't, as a family physician, I usually don't like people that are really sick or really complicated. I like my patients walk into the clinic, and I want them to walk out of the clinic and keep them healthy. That's my approach to healthcare, and that's what I really wanted to do. So that was one of the things that was really important to me, to keep people healthy instead of treating diseases, and that's why I chose family medicine. Anything else about aging? Yes.
I had a question about earlier. So, you said in the future that eventually there's going to be more elderly people, right?
Mm-hmm.
So, there on one side it says that having more people growing old and becoming older, which is perceived as being healthy, you're having a
Mm-hmm.
But on the other side, are you saying that we should have more younger people and taking care of a smaller quantity, or should we be focused on more
So I think the question that, oh, what an ideal population pyramid would look like is a hard question, and that is a question that as humans we try to control, and it's not always a good idea. So for example, you might have heard about China where they had the one-child policy, and now they have a problem which is called the 4-to-1 problem, where they try to restrict their population growth, but now they have one child that is responsible for 2 parents and responsible for 4 grandparents. And that's a lot of pressure on one person. So controlling population and what an ideal population pyramid might be the wrong question. The question might be, how do you, kind of respond to what you have? Know what I mean? So I think that's what we need to work on, because everybody is going to get old. Death and dying is still difficult. It's difficult for a 90-year-old, it's difficult for an 18-year-old. Nobody wants to die. Nobody wants to end that experience. We want to have a good experience, and we need to optimize that experience across a lifetime.
Are elders usually easy to treat?
Personal experience, no. It's a hard line. Again, as I said, in my training, I was treated in a more old school way, and things are changing now. But I was trained to treat diseases and not treat people. And old people are people, and they're people that are changing. So I think it's a different perception, and it's harder, as I said, to kind of differentiate what might be normal aging versus what might be a disease, and what our stereotypes go into that. Like when I think we talked about the mental changes, right? A lot of times, for a long time, it was just kind of, we talked about like everybody has dementia, but some people, or it's part of normal aging, but it's not. And a lot of research didn't go into it, but now it is. Now we're changing, it's not normal. So it is difficult, yeah, definitely difficult. Yeah, definitely. And I think as a society, we're not able to talk about death easily. We don't have good mental structures, cultural structures to talk about death. And I think that would change as we might get a different older population. Expectations might change from within the community and from the medical system. There's a really good TED talk about it. I think there's a physician, I can't remember the name, I can share it with your teacher later. And it talks about like going through talking about death with a patient. And there's so much that goes into it. It's about how you want to, what is beyond just your like will, like what things are going to but what do you want for yourself, and when you get old and when you get near that experience. There's a whole field of medicine called hospice care that just deals with that. It deals with people that are near death and how to optimize that experience and how to take care of them. So it's definitely a process that needs to be looked at as such.
Regarding that, what are their options? Can they choose not to take certain treatments?
So a big rule of medicine is like the person is an independent decider of what goes in their body. I can prescribe you anything you want and everything you need, but you can decline it because that is your right. So just like that, an older person can decline all those treatments that might keep them alive, but they might not, it might not be best for them. They might think it might not be best for them. And in that situation, their will matters more than what I think or what the family thinks. The least favorite thing, again, I think, is that difficult conversation that you have with yourself, that am I prolonging somebody's life or am I prolonging somebody's misery? And it's really hard, especially working with different cultural systems. A lot of times families are deciding a lot of things for the patient, and the patient might not be able to voice, or sometimes they're not even able to comprehend. Somebody might be demented, but might also have a lot of other medical complications, and you might just be prolonging that. So that's the most difficult part. The best part is, I think, once you kind of get over that hump of like looking at aging, I think, as a disease process, I think it kind of makes you recognize your own limitation as a doctor and our own limitation of what medicine means in our lives, and what just being a human means. You might have heard a lot about the opioid epidemic and how the medical system kind of over-treated pain, whereas pain is a normal response. And so kind of, I think that gives you that perception of what my limits are. I think that also helps you, keep yourself humble as a medical provider.
All right, you have about 7 minutes to go ahead and complete your notes. Make sure they are complete, that every part of it